You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Welcome back to I Am Refocused Radio. Once again, we are here today, and today we have a special guest. Our guest today, he brings perspective that shaped more than 50 years in healthcare, but also has helped him not just give back to the community, but educate the community. He is someone that you need to know. Dr. Robert Beltran is not just a special guest on the show. He's been on multiple platforms, including this one. He's also a pharmacist, a physician, a double board certified surgeon whose life has changed after a serious accident that led to another opportunity for him to give more value to you. Why? Because he's been through it himself personally, but he's also overcame it. His journey to rebuild his own health gave him not just a new perspective, but also gave him tools and not just education, but resources to pass along to you, the listener, and our viewing audience. I want to cut to the chase and say, first and foremost, Dr. Beltran, thank you for spending some time with us today. How are you doing, sir?
Oh, just thank you very much for having me on your show. I'm very thankful, appreciated, and honored. Thank you. Pleasure to meet you, Shamaya.
Yes, sir. Let's talk about healthcare. You have so much years in the health system. You know the ins and outs. What concerns you the most about the wellness industry today?
Well, it's a multi-pronged concern. You know, the pharmaceutical companies, in my mind, and I think I have the background to support this mindset, these comments that I'm going to make, they just produce way too many products that have compromising side effects. So on one hand, do they have benefits? Absolutely. On the other hand, do they have side effects that are compromising and have consequences? Absolutely. And to me, and I've been targeting a certain category of medications that I'm very concerned about, because I've seen through the years how they compromise individuals. And those would be antidepressants, mood stabilizers, sedatives, prescribed sleep aids. And I was harping on the concern for narcotics way before it became a major public issue. So we don't have to talk about narcotics, because I'd like to think, and I hope, that the public is now aware of what a major health issue that has become, not only for individuals, but for families and for communities. But yes, these other categories of drugs I mentioned are also a concern. The healthcare industry, in working in conjunction with the pharmaceutical industry, it's become a very unhealthy relationship. The healthcare industry is dependent, especially major university research centers, for a lot of money that comes from the pharmaceutical industry. And the net result is that a lot of the studies, a lot of the information we're seeing that's presented to the public has become somewhat biased and tainted and distorted as it pertains to educating the public as to the side effects that a lot of these prescriptions have that are coming from the pharmaceutical industry. And this is an area that's been a concern for quite some time. But when you have the pharmaceutical industry putting so much money into research that goes through major hospital medical centers, and also monies that go toward our lawmakers, it creates a situation where oversight that should exist is just not there. And so, as I alluded to and have mentioned previously, the information being shared to the public is often overhyped as it pertains to the benefits, and the side effects and consequences are very much understated. The nutraceutical industry, which I've been heavily involved with now for the last 12 years, also has some major compromises, and they even have identified these. I went to a major conference, a conference where west of the Mississippi, it's probably the biggest conference in America, in the United States. It's called Expo West in Anaheim. And what was interesting to me, and that was back in April of this year, is that so many of the speakers were alluding to the fact that we are starting to have issues in this industry because the public is getting concerned about so many of the bold claims that are made as it pertains to nutraceuticals that are in the marketplace without scientific support. And that is something that we identified when we started to consider going into the marketplace for this industry back in 2020. And the other major concern they raised is that the public is concerned with quality control, quality assurance, regulatory, and testing issues as it pertains to supplements that are going into the marketplace. And these are all valid concerns that need to be addressed by the nutraceutical industry.
Just now joined in, you're watching and listening to I Am Refocused Radio and talking to our special guest today, Dr. Robert Beltran. If you have a website that people can tap into and learn more about what you're doing and opportunities that you have as far as resources, what's the best website that they can head on to right now?
Recomnd.com. And we spell Recomnd RECOMND. It's a play on the word recommend, which of course doctors use hundreds and hundreds of times every day. So yeah, we just modified it a bit, give it a little bit of a unique twist, if you will.
I appreciate that. We'll make sure we have that in our show notes. When you think about you yourself, you have been a patient yourself. I said in the intro that you had a serious accident. You had to go on that journey of better health and healing. What did you learn from that chapter in your life, and how has that changed the way you view medicine?
Yeah, it altered my life pretty dramatically. I was in my surgical practice was thriving, and this was in late 2011, and I sustained a pretty significant injury, a series of injuries actually, a concussion, tore ligaments in my knee. And the worst part was I sustained a laceration to my hand, which cut tendons and a sensory nerve that was so important to sensation. And I'm right-handed, so my right hand is my dominant hand. So as a surgeon, of course, that really set me back. But I ended up having 8 surgeries in 18 months. 5 of those surgeries were considered major surgeries. And of course, along with that, you have to have pain control, and my narcotic of choice was OxyContin, and I did become addicted. And so I was on utilizing OxyContin for greater than 2.25 years, and that's very problematic. It really affects you in a lot of significant and dramatic ways. So the combination of being addicted to OxyContin, no longer being a surgeon, really put me into a tailspin. I became depressed. I became despondent, and my wife, thank God, she's my biggest cheerleader. She recognized that I thought I was hiding my addiction to OxyContin from everyone, but my wife, she's been around me for 50 years, so she knew that something was seriously wrong, and she addressed it to me in a confrontational manner, if you will, where she was so concerned that I was spiraling downward and that I had lost control of the ability to have decision making that was healthy and optimal for me. And she pleaded with me and basically said, you need to go into rehab or I'm going to leave you because I'm concerned with your well-being. So anyway, what could have been the worst situation in my life, I think, has evolved into the best possible situation. As part of getting off of OxyContin, I developed a very bad case of what we now know as brain fog. I was mentally and physically stagnant. I couldn't move forward in any manner. I just felt like I was chained to the sofa, for lack of a better description. I was so compromised. And I was talking to a lot of various colleagues of mine One of them was a gentleman of Chinese descent, and he had had some training in ancient Chinese medicine, herbal medicine, and he said he knew. My colleagues who are real close to me know I'm very anti-pharmaceutical for the reasons I alluded to earlier, that there's just way too many side effects for far too many pharmaceuticals. And my position has always been, if you can go a different route, if there's an alternative, another option, better off trying that option initially. So he suggested herbs. I was hesitant, but I did start taking them, and 3 weeks later, all of my mental and physical energy, all of my mental clarity, focus, and alertness, everything returned in full force. And then 4 to 6 weeks after that, I started noticing some pretty significant and dramatic improvements in my intimate life. And so I knew I was on to something special. And basically, for the last 12 years, I've been studying, researching, utilizing, modifying various combinations of herbal ingredients, various dosages, and I've come up with some pretty formulations that are pretty impressive in terms of the target benefits they offer, the fact that they're safe, and the fact that they promote vital and important physiological processes that are well known to improve healthy aging, preventative wellness. And to some extent, based on what it is they do, you have to infer that they're going to contribute to longevity in some manner. And the things I'm talking about are improving the microcirculation on an ongoing basis, promoting neuroprotective and neurogenesis, which is the restoration of damaged neural and brain tissue, and replenishing and optimizing brain neurotransmitter function, which is so important for how our various processes in our body are stimulated, and also, promoting brain power and brain health. So we know we're on the right track. We've created some very interesting ingredients. And when we talk to the public, it's always any medication in and of itself or treatment is not going to be the answer to healthy aging, preventative wellness, and that pursuit of longevity that everybody's after. It's going to take a holistic approach. You have to have the mindset, the plan of action that you're going to incorporate exercise into your daily routine. And it doesn't have to be vigorous exercise, although vigorous exercise does have its benefits, because the more vigorous you exercise, the more you increase the microcirculation throughout the body. And more importantly, when you exercise, you flood your body with endorphins, which are the body's natural opioids that give you this sense of contentment and just feeling relaxed and feeling good. And that is so important for modulating the stresses that we go through on a day-to-day basis. We also recommend meditation or some form of mindfulness, because meditation and mindfulness also cause the release of endorphins and what we call feel-good neurotransmitters, dopamine, serotonin, and GABA. And of course, those, as I alluded to already, those help the body relax and create a sense of calm that is so important for our overall health on a day-to-day basis. And then, of course, we recommend healthy eating, staying away from certain type of foodstuffs, moderating other foodstuffs. Moderate your alcohol. Alcohol has so many compromising consequences. It affects your metabolism. It slows down your brain activity. It compromises so many organ systems within the body. So people have to be smart. I'm not going to say that alcohol isn't enjoyable and shouldn't be enjoyed, but it has to be moderated. Anything greater than the equivalent of 2 glasses of wine 2 to 3 times a week is excessive amount of alcohol to be taking for any given individual. So that's kind of and then stress. We totally understand how compromising stress is in anyone's given life. So we are very, very mindful of that. And our recommendations are very strong towards moderating the response to stress. And in fact, we have three ingredients in our combinations of formulations: maca root, ashwagandha, L-theanine, which are all well known to modulate our response to stressful situations in our life, Shamaya.
I appreciate you sharing that with us. Once again, if you're just now tuning in, talking to our special guest today, Dr. Beltran, go to his website. He said it earlier, is Recomnd, and they spell it as RECOMND.com. That'll also be in our show notes. I have another question for you, because when we look online, there's a lot of social media health influencers who are paid by other brands to showcase and talk about what is out there on the market. With the issues of people being overwhelmed with all those flooding of information, what are some things that they should probably be skeptical on some of the health advice online, and how can they work with their doctor to make sure that they're getting good information to actually explore themselves?
Yeah, I'm glad you brought that up. Social media is just full of deceptive, misleading, and in too many cases, falsified information. From what I've been able to discern, it seems as if a lot of these are business people, very sharp and smart business people who create a business plan, and then they use the science, the facts, and the statistics to support that business plan. I was always of the mindset that the science, the facts, and the statistics speak for themselves. That used to be the mindset I had at one time. But I'm realizing now that the science, the facts, and the statistics can be distorted to meet whatever plan of action somebody has. And that's what I'm seeing all the time on social media. Let me give you a few examples. NAD+, which is $1 billion entity in and of itself. Numerous high-level studies have been initiated to study the effects of NAD+ in high-level medical centers. No one has ever had a patient who's been tested who's been able to say, I notice a subjective or objective benefit after having taken NAD+ over an extended period of time. None of the clinicians or medical scientists who are overseeing these studies have ever observed a noticeable change in any significant clinical marker to suggest that any type of anti-aging effect is occurring. NAD+ is important. It stimulates intracellular metabolism and energy, but it is only one very small process in numerous processes that have to occur to allow the body to improve itself in a manner that would be consistent with healthy aging, preventative wellness, and longevity. There are so many different physiological processes that have to occur for this to take place. Then you have people that are recommending that everyone should have a DNA analysis because of the MRTA, I think it's MTHFR gene that is noticed to be deficient in 40% of individuals. And yet 40% of individuals don't have any noticeable physiological or clinical compromises that they are capable of discussing. And they're saying that the deficiency of this methylated part of the DNA chain suggests that people have depression, emotional disorders, lack of energy, lack of compromised sexual activity, et cetera, and that's why everybody should have a DNA analysis and assess this deficient methylated area of the DNA chain, and let us treat it in this manner, that manner, whatever manner. And once again, the medical community has studied this extensively as it pertains to that particular science of DNA analysis. There are some applications in the field of oncology, but they are very limited. And in and of themselves, they do not change the approach to oncology, but they have shown promise in terms of specific markers related to treatment of certain oncologies, malignancies. But in and of itself, the applications are extremely limited. And what the medical community, the medical scientific community has identified is that there are just too many factors externally, environmentally, and internally that affect the clinical observations that these people are saying are related to the deficiency of this methylated part of the DNA chain to support in any way, shape, or possible that there is a direct relationship to that deficiency and the clinical symptoms that are being related to it by the people who are propagating this. And once again, we have a situation where these bioscience companies, whether it be Illumina or Life Health, I forget the names of the rest of them, but they created these tests, so they want to monetize it. So they're really the ones behind propagating the so-called need for DNA analysis amongst everyone in the public to see if they have this MRSA deficiency and to treat it accordingly, even though the medical scientific community does not support this. The other area where I have major concerns is we are all aware of how dramatic the effect was for male sexual wellness when 5-phosphodiesterase inhibitors were discovered. And I'm speaking the first one that was brought to the marketplace was Viagra. It definitely had a very pronounced benefit for men in the realm of benefits during intimacy. But now they're marketing multiple 5-phosphodiesterase inhibitors in combination, sildenafil, tadalafil, vardenafil, to be taken simultaneously. The problem is that all of the 5-phosphodiesterase inhibitors cause some degree of hypotension, and they all work a little differently in terms of their mechanism of action. So what you have is an additive effect. And what you're going to see is that there's going to be a lot of men who pass out from taking these combinations. And I don't know any physician who supports the combination of these 5-phosphodiesterase inhibitors, and yet you see them marketed all the time on social media as if they have no known side effects and they're only going to contribute to the benefit for men seeking enhanced sexual wellness. And now they're adding apomorphine to those combinations. And once again, apomorphine is a very powerful agent in terms of lowering blood pressure. So I think these combinations are known to cause so much hypotension that men pass out. They can injure themselves. And some men, the hypotension is going to be so dramatic, they're going to go into cardiac arrest. And once you go into cardiac arrest, all bets are off. I mean, hopefully they'll survive, but obviously some people are not going to survive. And then you have this, Adderall. Adderall has been prescribed for so many years. It's become an epidemic. And people take it, once again, as if it's totally beneficial and that the side effects are minimal. But the side effects from Adderall are pretty dramatic. Adderall becomes, after 6 months to a year of people taking it, it becomes the neurotransmitter of choice. And once that happens, to try to get off the Adderall, you go into a very deep state of depression because you're basically your body's neurotransmitters have gone to sleep, and the neurotransmitter of choice, as I said, is the Adderall itself, the amphetamine. And so it causes a dramatic physiological addiction because of that effect on the brain neurotransmitters. The other thing that happens with Adderall and/or energy drinks, 3 to 4 energy drinks, is dramatic swings in the blood pressure and heart rate, which on the short term can cause cardiac arrhythmias or irregular heart rhythms. And those of us in medicine, we're well aware of people showing up in the emergency room having to go to the ICU because they have these heart rhythms from overstimulation. And we're also aware, unfortunately, of people who end up in the morgue because they overstimulate themselves to a degree where they go into cardiac arrest. And once as I alluded to earlier, unfortunately, once you go into cardiac arrest, all bets are off. Hopefully you can be resuscitated if you have the right team of people that get to you soon enough. But if not, obviously it's a whole different story. So those are some of the concerns I have, that some of these too many situations are being led by deceptive, misleading, and falsified information. And the public is going to have to become aware that, look, whether they want to acknowledge it and accept it or not, there are experts in the field of health and wellness, and those experts are not influencers, they're not celebrities, and they're not highly paid spokespeople that can sell you anything. They're going to have to understand that there are experts in health and wellness, and these are the people they should listen to.
Once again, listen on Refocused Radio and watching us online, talking to our guest today, Dr. Robert Beltran. Go to his website, is Recomnd, and they spell it as RECOMND.com. It'll be in the show notes. We are flat out of time, but man, we can probably go again for another 30 minutes, but we will probably have to have you back on if you are up to that. And like always, want to say to you, give you a last statement where you want to say our viewers and our listeners before we officially go off.
To everybody out there in your public, your health and wellness should be your number one priority from the time you're 18 through the rest of your life. And that involves initiating healthy processes that we already alluded to. Start early, save yourself. What you don't want to do is introduce obesity into your life. And obesity starts with the BMI greater than 28. Because once you become obese, and even though you may not feel obese, by definition, you are obese when you have a BMI above 28. You introduce yourself to the world of diabetes, high blood pressure, and of course, early onset cardiovascular disease and increased risk of heart attack, stroke, and deep vein thrombosis or blood clots. So be smart, start early, and live a healthy lifestyle.
Well, once again, like I always want to say to our guest, Dr. Robert Beltran, thank you for your time.
Shemaiah, thanks for having me. I appreciate it.